Welcome to Aging on the Suncoast. I'm your host, Jason Martino. This year, the Medicare annual enrollment period started October 15th and ends on December the 7th. This period is a critical time for Medicare beneficiaries to review and understand their Medicare coverage. To help consumers in Pasco and Pinellas counties, the Department of Elder Affairs SHINE program provides unbiased, free, and confidential counseling to assist beneficiaries make independent decisions in order to maximize their Medicare health coverage. On today's show, we've invited Janet Mills, the SHINE Area Coordinator, and Charles Frankel, the SHINE Local Area Coordinator. Together, these two seasoned SHINE volunteers will shed light on a valuable program that has helped beneficiaries navigate a complex system of healthcare coverage for over 22 years. Janet, welcome to Aging on the Suncoast. Charles, welcome to Aging on the Suncoast. We're so happy to have you all here today.
Pleased to be here.
Yeah. So consumers in Pinellas and Pasco County, I think across the nation, are starting to receive their 2016 Medicare and You handbook. And I thought what was a neat piece is on the back it refers to the national SHIP programs that are in there. And then obviously for the state of Florida, we have the SHINE program here, and it refers to that. Do you mind telling the public a little bit about the SHINE program?
Yes, SHINE is a national program. It's called SHINE in Florida and SHIP and other names in other states. It was formed some 20 plus years ago. In the state of Florida, it is a volunteer program. And SHINE stands for Serving Health Insurance Needs of Elders. But we deal with far more than just elders. We don't like that word elders anymore because we don't consider ourselves old. But it is a volunteer program, and it does provide free, unbiased counseling to answer all of your Medicare-related concerns. And we hope you will call and take advantage of us.
Sure. A couple big buzzwords in there is volunteers. It takes a lot to be a volunteer, obviously. Free and unbiased. I mean, there's some pretty important words on there. Tell us a little bit about the volunteers, Charles. What kind of responsibilities do they have with the SHINE program?
Okay, well, this time of year especially, we help people review their plans, and there are a multitude of different options that people have when they get into Medicare. It can be quite confusing, so we can help them navigate that. Also, there are other things we can help them do. If they're having problems with their plan, they want to make an appeal, there are billing problems, we kind of help direct them through that process, you know, once again giving them the information usually to help them do it themselves. There are times when they might need financial assistance that we can even direct them to or help them apply for, paying bills, whether it's a lot of times with drugs, there are programs we can help financially. Sometimes you've heard the donut hole. We might talk about that more later. There may be some programs we can direct them to for help there.
Sounds like they're doing a lot. And it sounds like they're doing a lot of work that a lot of paid employees would do for different agencies on there as well. While we're talking about volunteers, a lot of times to be a part of large programs like this, you have to have some qualifications. Can you give us an understanding of what qualifications you've seen in your history by some of these volunteers?
Okay, well, we've had good volunteers from a wide variety of backgrounds. So there's no one particular, but it really requires, first of all, that you like to help people. You enjoy interacting with people because you're going to have to probe, find out what they really want, you know, and do some digging. It takes people who like to learn. It's a pretty intensive training program we have for the new counselors. And it does take a little more of a time commitment than most other programs do. But people who, you need to be computer literate. You need to like doing some research. You need to like continue learning. Yeah,
it sounds very much like lifelong education going on as well. All right, so the SHINE program, a large program that helps people out with Medicare review of plans and some other things that we're going to go into great detail later on. What types of individuals do they actually assist? Is it the types of individuals that the Area Agency on Aging normally serves, the 60 and under, or is there a plethora of different diversified?
Well, there can be some correlation between the other programs that go on at the area agency, and oftentimes they are referred to those programs. So it isn't calling the Area Agency on Aging can be all-encompassing to some degree. But the beneficiaries that we help are people who currently have Medicare, and as Charles mentioned, who are going to be new to Medicare and need to make choices and know what their options are. We also talk to a lot of people who are under 65 who are on Medicare, who have Social Security disability, which allows them to have Medicare health care after a 2-year period. And we also talk to a lot of people who are caregivers for people who are on Medicare to help them with the complexity of the situation and answer their questions. So it's a wide variety.
That makes great sense. It's not everybody can just fit into a nice little neat box and then you can serve them in like a compartment, huh? We serve a great diversity of people out there as well. Now, how does one get a hold of the Shine program? Is there a magic number that they get to call, or if they were internet proficient, can they contact the Shine program through that?
There are 2 big options to do that, one of which is to call the Area Agency on Aging, 1-800-963-5337, and ask to speak with Shine, and it will be referred to us. We also have a wonderful floridashine.org website, and you can go on the web and find out more information about individual counseling sites and how to call the Area Agency on Aging as well. So there are 2 big options now.
Yeah, it's always nice to have options. And for our public, what Janet was just talking about, we're going to run some graphic information during the break and during the end of the show. So if you have a pen and paper handy, that might be helpful for you, because we'll put some URLs for the website and also the number that Janet had said before. To get Shine assistance, obviously, we know now how to contact the Shine program as well. And can consumers just get the help that they need over the phone? Can they have one-on-one? Do they have to come to the agency? Tell us a little bit more about where they would get the help that they need.
I'll take that.
Go ahead.
Okay, a combination of those. There are a lot of things that we will do over the phone. It works very well. We can compare plans, we can mail them out some of the options, we can address a lot of their problems. If necessary, we can do conference calls with others that may need to be involved. We also have outreach sites. And Janet mentioned how you can find out where those are. You can call the number, you can go on the website to find what they're and how to get to those. Is also sometimes individual counselors may be able to, that you're working with, may be able to arrange a place to meet. Unfortunately, we can't go to someone's home. That is not an option, which would be nice, but we're just not equipped to do that.
Understood, yeah.
Yeah.
Yeah, and the Area Agency on Aging serves individuals in both counties. The Shine program obviously has outreach sites in both counties, is Pasco and Pinellas.
Pasco and Pinellas both, yes.
Okay. So we, during the opening of the show, I mentioned that the annual enrollment period was October the 15th through December the 7th. And but there's a lot of people, I believe, out there that don't really know what the annual enrollment period is. Charles, would you like to give a broad overview of what that time frame is?
Yeah, as you mentioned, it started yesterday. Yeah, October 15th,
right.
And it runs through December 7th. And that's that same time period every year, even if those dates are a Sunday. And during that time, the AEP, as we call it, and you sometimes think of that as already enrolled period, because it's people who are already in Medicare, and this is a time when they can review the plan they have. They have several options. They may get an Advantage plan. They can stay with original Medicare, get a drug plan. This is when they can change. This is the only time when, for most people, there are exceptions, where they can change. If they have a drug plan they want to review, see if there's a better one. If they're in an HMO or a PPO, they want to see if there's a different one or a better one. Maybe their doctors have been dropped. Maybe the copays have gone up. Plans change every year, sometimes dramatically. So it's always a great idea to review your plans, see if there's something there that would suit you better, and we can help do that.
Yeah. I like your little analogy about already enrolled in the program too, because I guess one of the questions that I have is it a AEP that period? Is it a good time for people that are becoming new to Medicare? Is that a good time for them to also call Shine and have inquiries about their Medicare coverage?
People become eligible all year round, including during the AEP. So it's actually, some people find that during the AEP, say they're in November, they're new to Medicare, they need to choose a plan. We look at next year's plans also to see if it's the right plan for the next year. Sometimes people are enrolled for a couple months, change plans for next year.
Yeah.
But yeah, and just enrolling to Medicare, that itself, there are a lot of things that are not straightforward. we can help sort that out for people.
Yeah, now, I'm not well versed at all in Medicare. As a matter of fact, I think that it's as complex as what everybody seems to tell me it is over here. And I know when I was preparing for the show that I was having a hard time understanding what the Medicare Advantage prescription drug plan is. Would one of you want to to elaborate a little bit about that is and how it really fits into the review period during AEP or annual enrollment period?
Yes, like Charles was alluding to, you can call Shine and we will help you if you give us your drug list, just the way you take it, and we can run it at Medicare.gov. It's a computer program, and it will tell us what the best Part D, if it's an individual plan, is for the next year. And we can send out printed information to you on that. If you're in a Medicare Advantage plan, it has become increasingly important to check the drug coverage under your plan. It can make you choose one plan versus another plan if your doctors take both plans, because all the formularies, the drugs that are covered, are different in every program.
Good point, and that probably highlights the necessity to take this serious during this time frame, so you can take a look at your drug formulary and make sure that you're getting the best bang for your buck with all the things that you need in there.
I might just say that people are reluctant to do that because it's a bit of a hassle. And they've been through it once usually and say, okay, I found it, this is for me. I had someone yesterday called up, they just wanted to look at, they had a standalone drug plan. They thought they'd just stay with it, they liked the name. I looked, they could save $1,000 a year by changing.
That's nice,
yeah.
And that's a good testimonial. I have in my past I've dealt with some people that were seniors, and I tried to get them to understand the importance of the AEP time. And I was told small things like, "Oh, my company just treats me so well," and they didn't want to take advantage of looking at different options on there as well. I imagine as seasoned volunteers that you all deal with that from time to time as well. How do you show that importance to somebody that that they should review their plan on an annual basis?
Well, I think when somebody has done that, they realize that it is a great thing to do, and Shine can do it for you. So it's not a painful process.
Yeah.
And the proof is in the print, actually. If you run the program and it tells you that these drugs are cheaper under this company versus the company that you currently have, then it's your choice to make that change or not.
Okay.
We don't tell you what to do. This is an education and advocacy program.
Yeah.
And there are frequently factors other than just cost. They're important to people. So all we can do is point out the differences in the plans, and they make their own choice.
Yeah. Speaking of costs, the buzzword a couple of years ago, and it's probably a yearly thing, is the gap or the donut hole. Do you want to give us a little explanation of maybe how the review of their plans during this time frame may help mitigate some of that?
Right. The Medicare.gov program has a graph on it, and it will show you on the printout of the various plans that you would run for people, and it shows you when you were going to go into the donut hole, if you do, at what point, and what point you might come out the other side. And this year, it was $4,700 of your own money, and then you went into catastrophic coverage. Each year it changes just a little bit. And it is supposed to close. The gap is supposed to close in 2020 as things are now projected,
well,
hopefully.
Let's hope so.
You want to add something, Charles?
Just that when you do see that perhaps you see in June you might go into the gap, we can help you think through, are there some things you can do there? And depending on your income and resources and other things, there may be some other programs that could help during that time, and you can be made aware that you're going to need to do something around that time of year.
Nice, nice. Now the Shine program operates I won't say 365 days, but it operates all year round. Give us an understanding of what you guys do when you're not in the annual enrollment people. What can volunteers help people with during that time frame?
You can participate, and we do have a presentations class that you can take, and we do a lot of presentations in the community because Shine doesn't translate very well as to what we really do to help people. And so we try very hard to make ourselves known and to educate. We go into businesses, and we go to places like Pinellas County School System to educate their impending retirees as to what their Medicare options
Great
are.
idea.
So if anybody needs to have a presentation by Shine, you need to call that 1-800 number, and we will try to accommodate your need.
Nice.
We love doing outreach.
Yeah, and I'm very familiar with the program, the broad aspects of the program, and we're so proud of what you all do on a daily basis. And I guess during the annual enrollment period, and it's only, what, 2 months, that someone has to make these critical decisions and really just learning how to maximize and understand what their health care coverage is the decisions that they make during that period they're going to have to live with for the entire year. So it's
a good point.
That's
yeah,
correct.
so it's the diligence that they do is going to pay off in the future in there.
I might just add on to what Janet was saying, that during the year, as people become eligible for Medicare, people new to Medicare sometimes have options that they're not aware of. And we can help them sort through that. And if you don't take certain actions within a certain period of time, there can be some severe penalties for that.
Great note, Charles. Thank you very much. Please stay with us while we take a short break. As usual, don't forget to have a pen or pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center helpline, as well as the State of Florida Shine website.
Sarah is 64 and loves to garden, but recently her health insurance ran out, leaving her worried about more than just weeds. With pre-existing health conditions, Sarah's chances of finding good coverage were low. So she called the Elder Helpline and spoke with a Shine volunteer counselor. The Department of Elder Affairs Shine program provides free, unbiased counseling on health insurance for those on Medicare. More information is available about Shine or how you can volunteer at 1-800-963-5337.
Welcome back to Aging on the Suncoast. During the first half of the show, Janet Mills and Charles Frankel helped us understand how the Shine program can help Medicare beneficiaries make critical decisions unbiasedly and for free. So let's continue this important discussion and delve into some additional resources that can put money back into your pocket. Janet, welcome back to the show. Charles, welcome back to the show as well. Okay. We talked a little bit during the first segment about what the Shine program was and what the annual enrollment period is. And we knew that that was a good time for consumers to take advantage of the programs that you guys administer and to maximize their benefits and to further understand what their health care coverage is as well. And, but we have some other programs out there too. The low income subsidy is one program that I think has been helping people for a long, long time. And I'll start with Charles. Can you tell us a little bit about what the low income subsidy is?
Yeah, this is a terrific program for people. What it does is it helps with the cost of their medications. It works in conjunction with the Medicare drug plan. It can do things like Janet mentioned, the gap. It eliminates the gap, lowers copays, can help pay for a plan. It also has an added benefit that we said people can only change during the annual enrollment period. If you have the low-income subsidy, you can change during the year plans. If you find it's not covering your medication, you're not getting the service you need, you can change. So tremendous benefit. And there are people, it's for people who have Medicare. It's a Social Security Medicare program. So it's not a Medicaid, like some of the other things Janet might talk about, but it works in conjunction with that. It's based on people's income and asset levels. Okay, in general, if you're an individual and you have income of a little less than $1,500 a month, assets of a little over $13,000 a month, we encourage you to apply, even if you're close, because there's some sorts of income and assets they don't really count, and we're not, we don't get into that detail. Apply, let Social Security sort it out. But if you're accepted in this program, the benefits are terrific help for a lot of people. And there are a lot of people who are eligible for this that are unaware of it. Yeah,
well, it's good that you're talking about that. And I guess one of my questions is people don't, or comments really, is that people don't have to go out there and do the work. They said they can call the Shine program and they can get Shine from a Shine or help from a Shine
We can
company?
actually either over the phone or if they're with us at an outreach site in person, we can go to the Social Security website and enroll them. The process takes 10 to 15 minutes.
Oh, nice.
Yes, so this will put them in the application. They should hear usually within 2 weeks if they do it that way, whether or not they're accepted.
What a process, 10 to 15 minutes. That's not like the normal
For
application
people,
process.
there are some cases where people don't want to do it over the line, the information doesn't click or something. There is also a paper application that we can give them, same application. They send that off, and it'll take a little longer in that case. But the online is the easiest way to do it.
So again, free. They can call the SHINE program. They can get help with their low-income subsidy application. It takes 10 to 15 minutes. Is that the same for the determination, the notification that they get after they've submitted the application?
Well, once they submit the application online, it comes back immediately and says, okay, the information we have matches up. We will process. It's accepted for processing. But then it'll be a couple weeks maybe before they will receive notification from Social Security in writing as to what the determination is.
So Social Security is the one determining. It's not the Area Agency on Aging. That's
No,
correct.
Okay.
but we send them a confirmation page, that printout that indeed says it
And
was
what
a
the next
successful
steps are
submission.
and so
Right.
forth. Yeah.
Well, I bet that's helpful, and that gives them sometimes more information is good information for them as well. So thanks for explaining the low-income subsidy. I'm really hoping that people take advantage of that program because it sounds like it's very helpful. Janet, we talked a little bit earlier about that Medicare Savings Program as well. You want to give us a little understanding of what that program is?
Yes, the Medicare Savings Program is a program that is applied for through Medicaid.
Oh.
And that is another process that we can help you with. Take maybe 15 or 20 minutes, either in person. We cannot do it online unless you're with the person. But we do a paper application. We send it to you for your signature and your dating of it, and it is sent to Department of Children and Families. We send it with a pre-addressed envelope and a cover letter that explains. That takes about 4 weeks to process, and that letter of determination comes from Department of Children and Families, and that program can help you to pay your Part B premium, and even more if you are really low income. And it is a very good program to apply for, absolutely.
3 great assets that we've talked about thus far. The SHINE program, helping people understand their health insurance that they have through Medicare, and then 2 additional programs that could complement all of that to save them a little bit money when money can be very tight for some seniors out there that have living on some pretty fixed incomes. Is everybody eligible for the MSP program, or are there thresholds and things?
No, the monetary threshold is for a single person is about $1,345, and this year per month income gross, and then the asset level is $7,200 this year. Every year it changes a little bit. We will have new figures probably mid to late January.
All right. Great programs. Thanks for sharing with them too. I want to go back to the SHINE program because of the importance of it. We talked about the fact that it's a volunteer-driven program. We know that the volunteers are considerably trained to understand all of the different complexities of Medicare to help others navigate that complex system. I know that the Area Agency on Aging, that's being one of 11 around the state of Florida, but the Area Agency on Aging that represents Pasco and Pinellas County, they served over 20,000 people with Medicare types of questions or inquiries last year. If one wanted to be a volunteer for that program, can you give us a little understanding of how they could get involved if they have a desire to?
Sure. I think the easiest way is you can call the 800 number, or you can go to the website. You eventually have to go to the website anyway to actually put in an application to become a volunteer. But as a volunteer, it is really a very rewarding program, but it's a little more intense, I'd say, than your typical volunteer program too. So you need to be able to have a pretty good time commitment. You need to realize that there's some substantial training involved, both initially and ongoing, that it is a year-round program. We're in a really busy section period right now, but as you can tell, there are lots of other things that we need to do. Jan, do you have anything to add to that?
It is a 2-year commitment. I think that's important to mention when you sign up to take the training. The training is a several-day training, and then you are tested. And if you're successful, then you move on to the mentoring process, and that is a several-week process with an individual seasoned volunteer. And there are always people available to answer questions within the program, so you're not left off on your own. So we try to make it very comfortable, and we work as a team.
Thank you. We talked a little bit earlier about the confidentiality that is involved with this, and as an area agency on aging employee, we have several programs that you have to have level 2 screening. Is this a process that happens for Shine volunteers as well?
It is.
Yeah.
Yes, you do have to have the level 2 screening. It is very important to our program.
Yeah, it also sounds like myself, even though that I'm interested in the program because I work full time, maybe it's not best for me or the consumer out there that I would have a hard time allocating my time to be working and putting in the time commitments as said for the volunteers. I think that's an important note in there, and I think a lot of people may have the desire to do that. But because of the commitments that you guys are so busy all year round, how can one possibly balance working full time and doing that too?
It's very difficult.
Oh, I bet.
It has been done, but it's unusual. So in general, the people who are doing the volunteering are usually retired or otherwise, just not having the huge time commitment somewhere else, or they can't give the time needed to this.
Oh, I bet.
But it is very satisfying if you fit into that category, that you have the time and you love to learn. It is an extremely satisfying program.
Thank you for saying that, because I was going to ask, is I volunteered for some programs when I was younger and when I had a little bit more time to commit to it. And one of the things that I learned as a human is that I really took as much out of that program as I gave. It was very gratifying, and I was very satisfied in helping other people. And I'm guessing out loud that the Shine volunteers must get that same gratification from helping people that are in a pretty tricky situation.
Yeah, well, as Janet mentioned, it's a 2-year commitment, but I've done it for 8 years now. And personally, I'm in a position where if I don't enjoy doing it and get a lot out of it, I'll find something else to do. And I think, and I'm a newbie compared to Janet. So I think most volunteers, who stick with it, certainly feel that they are getting a lot out of the program.
Yeah.
And there are other things you can do. For example, we talked about the training. I'm now a state trainer, so we give things like there's currently a 3-day initial class that new people have to start with, and then there are other specialty courses that we give as well.
I imagine with the amount of volunteers working with this program, I think I understand there's about 60 of them. Obviously, there's a team approach to it. Obviously, some friendships are being built and working together and working together to help the person out there. So, Janet and Charles, I so appreciate you coming on the show and talking about the Shine program and the very important period that we're in right now, the annual enrollment period. I'm hoping everybody takes this information seriously and does give you a call. We hope you enjoyed this month's broadcast. We also hope this episode sparked your interest to contact the Shine program in order to seek help during the annual enrollment period. Please remember, this critical period ends December the 7th. We'll see you next month, and until then, please make every attempt to maximize these free resources.
Soon it will be time to make important decisions about your Medicare prescription drug coverage. The Florida Department of Elder Affairs Shine program can provide free, unbiased guidance in selecting a Medicare Part D or Medicare Advantage plan. If you have questions or need help, Shine can guide you through the enrollment period ending December 31st. More information is available about Shine at 1-800-96-ELDER. That's 1-800-963-5337, or on the web at floridashine.org.